My name is Robert Lerrigo. I am a gastroenterologist, just graduated fellowship from Stanford, and I have a special interest in inflammatory bowel disease.
Amber here from the Ostomy Diaries. So my next question is, a lot of patients feel that prednisone is the go-to treatment every single flare or issue. So what are the long-term side effects of prednisone, and why can it not be taken more frequently?
Yeah, so prednisone is a drug that reduces inflammation. It's not a very specific drug, so it's not specifically targeting the pathways within IBD. It's a dirty drug, and that has a lot of different side effects. And so the philosophy between steroid use is it's never something that should be taken chronically, or at least the intent shouldn't be to take it chronically. It's really a drug that we use to kind of hit the immune system hard up front, and give another drug time to start acting, so that we can eventually taper down on the steroid use. So that's kind of our general philosophy. Now, specifically, side effects of steroids, why don't we like using them for long periods of time? People can have things like osteoporosis, osteopenia, or a decreased bone mineral density. And that's why patients who have been on steroids for long periods of time, cumulatively in their life, should be screened for things like osteoporosis, because they're at increased risk for that. And it can also increase your risk for developing things like diabetes, increasing your blood sugar. So people who are diabetics who take steroids, their blood sugars are just all over the place, and it's really difficult for them to treat their underlying diabetes. It can also affect your adrenal glands, and make them produce less of the hormones that they typically produce. People can develop adrenal insufficiency, which is associated with low blood pressure, nausea, vomiting, abdominal pain, fatigue, fever. Rarely people can develop pancreatitis because of steroid use. It causes agitation. You're just kind of ramped up all the time. Insomnia, difficulty sleeping. It increases your risk of infection, particularly if you're on higher doses of steroids for long periods of time. And over time, it can also influence the liver as well, and cause fatty deposits within the liver. And you don't want that, because that can cause some inflammation in the liver. And prolonged inflammation of the liver is always a bad thing. So the laundry list of side effects, I think, is really quite long with steroid use. And if you're finding yourself being on steroids very, very frequently, then I think it's really time to chat about your gastroenterologist about what other medical options there are to get you off of steroids.